Although sometimes when you go and you sit down for an appointment, they start talking about things that aren't health, and you're like, hey, can we get back on topic? I don't really want to talk politics with you. Well, what if your doctor tried to register you to vote while you were sitting there? What if, let me take it a step further, what if you were a psychotic person and your doctor said, you know what we should do right now? We should register you to vote. Well, it turns out that's apparently happening, at least in Pennsylvania. Joining us now with the details, Aaron Sibarium is a reporter for the excellent Washington Free Beacon, and he joins us on the phone. Aaron, always good to talk to you, sir.
Thank you for having me.
Okay, so what is happening in Pennsylvania? I've seen a lot of headlines about voter registration there. Republicans are actually doing quite well this cycle, but is there an effort going on inside the hospitals to change that?
Well, there is a heavily Democratic nonprofit called Vot-ER that has doctors register their patients in clinical settings. And one of the institutions that this group has partnered with is the Pennsylvania Psychiatric Institute. And at the Pennsylvania Psychiatric Institute's inpatient clinic, so this is for people who need around-the-clock supervision because they're too mentally ill to be on by themselves since they're a danger to themselves or others, they are handing out basically materials that people can use to register to vote. And going up and asking pretty much everyone, it seems like, whether they would like to register to vote. And we know this because the initiative started all the way back in 2020, and the people who did it very helpfully wrote an academic paper in which they just explained what they did. And the paper explains that there were absolutely no restrictions on which inpatients were eligible for these so-called voter support activities. So, and it also told us that the clinic had a number of patients who were involuntarily committed and had psychotic disorders. That's an exact quote from the paper. So just in their own telling, we know that they are apparently registering psychotic patients in a mental institution to vote.
Okay, if you're involuntarily committed to a psychiatric facility, that means you can't make decisions about yourself. How can you make decisions about our country?
That is a great question to which I did not receive a reply when I posed it to multiple people at this institute in an email. But look, I mean, you know, maybe there's some mitigating context here, but from what I can tell, yeah, these are folks who maybe they're not all they don't all have the same conditions, but at least some of them really are the kind of people who they're there, as you say, precisely because they are not capable of being there on their own. So people who are not mentally healthy enough to make decisions about their own lives are nonetheless being asked to make decisions about the health of the entire nation.
Can I just point out an inconvenience that's associated with this? And then I want to dig into who these people are who are behind this initiative. But, like, when you go see a doctor, their time is pretty valuable. It's kind of limited. You only get, in some cases, you only get a few short minutes with the actual doctor to talk about whatever your medical condition is. How is it that they're wasting time on voter registration conversations in these examination rooms?
Yeah, well, I mean, so one thing that's worth emphasizing here is that they've done this in emergency rooms, and they've done this in the NICU to the parents of infants who are in critical condition. And again, they brag about all this. It's not hidden. They put this on their website. So yeah, that really I think is a concern because you have them doing it in settings of medical emergency, right, where time is of the essence and where doctors are overworked. So. Yeah. You know, if I were in there, I don't know, if I were there and I had something wrong with me, I would really want my doctor's undivided attention on my health and not on my voter registration status.
I know. Just imagine the procedures at these hospitals, though. It's like you got to make sure to wash your hands, you have to sterilize your equipment, and you have to hand them a voter registration form. That's how you deal with these patients.
Yeah.
So who's behind this? You told me it's called Vot-ER. What more do we know about this group?
Well, so it was founded by a former Kamala Harris staffer named Alistair Martin, who is an emergency room physician at Harvard Medical School. He was in the White House's Office of Public Engagement from 2021 to 2022. The rest of the group, I would say, it's from what we can tell, it's all very progressive people, even though the group says it's nonpartisan. A lot of them have cut checks to prominent Democrats. Many of them have terms like anti-racism and intersectionality and diversity and inclusion in their bios. And perhaps most tellingly, the group is clearly targeting traditionally Democratic constituencies because they have an application for...
Like the mentally ill?
Well, no, I mean, but so what they do is they have a, well, I mean, yes, them too, but they have an application for clinics that basically want grants from the hospital to integrate the voter registration materials into their healthcare delivery, and that application asks, are the majority of your patients Black, African American, Hispanic, LGBTQIA+, et cetera, Not every demographic listed is equally Democratic-leaning, but the majority, and 24 years and younger, right? 24 years old and younger. But a lot of them are. A lot of the ones they're asking about. So why would you now, granted, maybe they genuinely believe those people are in some way underrepresented, and so it's important to prioritize them. Okay, but still, you are asking for demographic info about a clinic's patients. You wouldn't ask that on the application unless you intended to use that information to decide how to allocate your resources. So it seems pretty clear, and by their own data indicates that their clinics are ones that predominantly serve African Americans, Hispanics. So clearly they are disproportionately focused on registering voters who do, statistically speaking, vote Democrat more often than they vote Republican.
So how is this not? So I assume these medical centers, these facilities, just like almost every medical facility in the entire country, receives federal money. That as a part of their operations revenues, they're actually receiving federal money. Doesn't this violate federal law to be involved in what is pretty obviously a Democrat get-out-the-vote scheme?
Well, I mean, unfortunately, or not unfortunately, depending on your point of view, it doesn't obviously violate federal law because federal law actually does let healthcare centers do voter registration. So as long as you say that you're nonpartisan and don't endorse a particular candidate,
sure,
you're in the clear. Now, of course, right, the problem is that it's very easy to put your thumb on the scale in very subtle ways where you say, well, you should vote for, we're not telling you how to vote, but you should register to vote because the power structures of society are influenced by your vote, and it's important to get the terrible pollution out of the air. You're not telling them to vote for Democrats, but anyone with the vaguest political awareness will kind of hear that language and know, hint, hint, who's the party that this doctor thinks is going to do that. And so, right, this is the problem. There's a kind of, they have just enough plausible deniability that they most of this really probably is not illegal.
Yes.
But it clearly is going to have the effect of pushing a partisan agenda.
Well, it's obvious to anybody with two eyes and two brain cells to rub together what's happening here. And the other piece is that we have entire categories of federal law that measure things based on disparate impact. I mean, in fact, the Civil Rights Act was kind of built around that theory. They drew a voting district in such a way that it diminished the power of black voters.
Yeah.
That obviously is, you don't even need any sort of explicit declaration that was the point. And of course, then the courts get involved. Here, it seems like nobody seems to care that this is a full-blown Democrat get-out-the-vote scheme being paid for with federal tax dollars, and a Kamala Harris lackey who is now registering mentally ill people to vote.
Yeah, no, and I think that's the disparate impact point is a really, really good one. I'm glad you brought it up because, right, like obviously it's common for people to say, well, okay, sure, this policy has, disparate impact, but the intent is not to do that, right? So it's not fair for you to call us racist or whatever. But like we've decided as a country, maybe we shouldn't have, but the law of the country is that, in fact, when things have disparate impact, that can be grounds for corrective action. And so if you accept that principle, it's hard to see why it wouldn't apply here philosophically. I guess the
exactly. Just be consistent.
When it helps Democrats, but not, or when it doesn't. I don't know.
That's wild. So in your coverage of this, of what's going on in Pennsylvania, clearly this is a state that Democrats are really concerned about. The evidence is definitely demonstrating that there's a lot of Republicans who are being registered to vote in that state, which I think is very good news. To what extent do you think Democrats are going to be able to make up this ground with efforts like this?
Yeah, I don't know. I mean, so look, obviously the Psych Institute itself, that's only like 50, 60 votes. That's not going to determine it.
Yeah,
but
for sure.
But when you look in the aggregate, this group says that I'm not sure if it's that they've registered 89,000 people to vote, but I think 89,000 people have either checked their polling location or their registration status or registered to vote. So like we're talking tens of thousands of people who have been registered to vote through this organization across the United States. And because of the way the Electoral College works, depending on how, say, 50,000 people are distributed across swing states, that can, in principle, make a difference. So, and this group does brag about how they they disproportionately turn out African American. The badges are disproportionately used by clinics that are predominantly African American. And, not all of them, but a lot of the places they partner with, I think, are in urban areas that are going to lean blue. So, yeah, like in principle, on its own, would it be enough to swing the election? Probably not, but it's not trivial. I mean, it's not like it's just, it's not like the stakes of this are 200 votes. Like, the stakes of this are tens of thousands of votes. And so, in Pennsylvania, look, I mean, it wouldn't be nothing. It is not an insignificant factor.
Two last points. One, you said that this organization, Vot-ER, which once again we're talking to Aaron Sibarium and about a former Kamala Harris staffer who runs this organization. They're registering people to vote even inside of mental hospitals, having doctors do that. One of the things you report is that they have scripts for these doctors to convince their illegal alien patients to get their friends and family registered to vote?
Yeah, basically what they do is they say, well, generally in the U.S. citizens can't vote, but, you can, non-citizens can't vote.
Right.
But, what you can do is you can show this badge. This is how it works. There's a badge and it's a QR code that people can scan. And they take a picture of my badge and then show the picture to your documented friends and family, and then they can scan it and register to vote. So, yes, they are explicitly focusing on registering not illegal immigrants themselves, but the families of illegal immigrants who are documented.
Sure. Yeah, once the illegals handling it, it's not their business anymore, right? So anything could happen. The other piece here is that you spoke with people who deal in the realm of psychiatry, and you asked them what they thought of the ethics of all of this idea that you would take somebody who is suicidal or schizophrenic or isn't voluntarily admitted to these mental hospitals. What do experts in psychiatry think of this practice?
Well, at least some of them told me that they think it's deeply unethical, or at least that it raises serious ethical concerns. Especially, right, it would be one thing if this were only done to patients who were about to be discharged and thus, almost by definition, had been stabilized enough to leave. Right there, you could say, okay, maybe it's not so bad. but that they explicitly say that they do it for patients, even if discharge is not upcoming. So yeah, I mean, I talked to a ethicist who literally ran the ethics center at NYU's medical center for 3 years, and she said, yeah, this raises some real worries. And the other point some other folks made is, look, these guys are if you're there involuntarily, there's going to be an implicit element of coercion anytime your doctor asks you to do something, even if they just suggest it and say it's optional, because you might worry like that if you don't do it, that you're going to be there longer and it'll be deemed as non-compliant. And of course, even if that's not true, well, by definition, people in mental institutions are not in possession of their full faculties, and so like the very fact that you're bringing it up, even if you don't plan to adversely, affect their care in any way, they might think that their care will be adversely impacted.
Yes.
So that's itself a problem.
There's a cruelty to this, obviously, and they're taking advantage of people who are in a very difficult moment in their lives, and their doctors, rather than healing them, are taking advantage of them on behalf of the left, which is grotesque, clearly. Aaron Sibarium, thank you for covering it from the Washington Free Beacon. Always good to talk to you, sir.